It is known as the silent thief because it often goes undetected until a bone breaks or fractures, leaving 1 in 4 women over 50 vulnerable to loss of mobility, independence, and increased risk of death. The condition is osteoporosis, and surprisingly, researchers say that at least 80% of fractures in people over the age of 60 are related to osteoporosis. The most common places for a fracture to occur are in the wrist, spine, and hip. Direct annual costs of treating osteoporosis and the fractures it causes are estimated to be approximately $1.3 billion. Iris Richman knows what it's like to be diagnosed with osteoporosis and to learn how it could impact her quality of life.
When I was diagnosed with osteoporosis, I was absolutely shocked. Didn't think this could happen to me.
A 50-year-old woman has a 40% chance of developing hip, vertebral, or wrist fractures during her lifetime. Despite the availability of treatments, osteoporosis often remains undertreated, as challenges with currently available medications can include side effects and difficult-to-follow schedules.
Well, one of the major roadblocks of treating people with osteoporosis is actually getting them to adhere to their medication and take their medication according to what their physician prescribes. Some people simply don't follow the treatment schedule that they're supposed to be on. Some people have side effects from different types of medical options that they try to take. That's why it's very important to us at Osteoporosis Canada that patients have access to different treatment modalities so that they can find the one that's right for them.
Health Canada has recently approved Prolia, a new treatment for osteoporosis in postmenopausal women at high risk for fracture. Unlike existing therapies, Prolia is a targeted therapy that treats osteoporosis by blocking the rank ligand protein to stop the cells that break down bone. Dr. Aliya, clinical professor of medicine at McMaster University, says
osteoporosis can be treated. We have a number of valuable treatment options which enable us to prevent fractures of the hip, the spine, and the forearm. Currently, we have many people who are not diagnosed and are not being treated for this common condition. Prolia is a new treatment for osteoporosis. It decreases the rate of bone loss, it increases bone density, and it can prevent fractures in people with osteoporosis. Prolia is given every 6 months as a simple shot by your doctor, and it prevents fractures.
I had a significant improvement while I was on Prolia, especially in my lumbar spine. Prolia has simplified my life in that it is so convenient, an injection twice a year.
the most common adverse events with Prolia were back pain, arthralgia or joint pain, and hypertension. The most common serious adverse events were osteoarthritis, atrial fibrillation, and pneumonia. Physicians should become fully familiarized with the efficacy safety profile of Prolia and the full content of the product monograph prior to prescribing the drug. As women age, bones shouldn't break without significant trauma. However, osteoporosis-related breaks among women are more common than heart attack, stroke, and breast cancer. Dr. Khan comments.
Women should know why osteoporosis develops and what steps they can take to prevent osteoporosis and fractures. This will enable them to live full, healthy lives without fractures and ensure that they have the best bone health possible.
Dr. Aliya says regular physical activity, proper diet, and taking appropriate calcium and vitamin D are things that you can control and are important for overall bone health. For more information about osteoporosis and how to protect your bone health, visit www.healthandbone.ca.